From the gateway to showbiz glory, this is Hollywood 411.
According to court papers obtained by Hollywood 411 Monday, we now have a play-by-play of what happened the day Michael Jackson died. Dr. Conrad Murray admitting he gave Michael Jackson drug after drug in order to help him get a good night's sleep. Joining us now to discuss, Dr. Reef Karim, an addiction specialist. Thank you for joining us, Dr. Reef.
Thanks for having me.
Well, I think it's an understatement to say here that this cocktail of drugs and this timeline is not the typical protocol for treating insomnia, right?
Right. I mean, we're talking about many medications here, and especially two of them, the propofol, diprovan, and the Versed, midazolam, are two very short-acting sedative hypnotic type drugs that are very dangerous when given in acute situations like this, especially unsupervised, where there's not an anesthesiologist, there's not, we call it hemodynamic monitoring, where you monitor blood pressure and pulse and all of that, and combined they can have bad effects as well.
Right. So even though to the casual glance it may look like all these serious drugs, really it's those two specifically outside of a hospital setting that are the kicker for you.
Yeah, absolutely. And we have to keep in mind the combination here of these drugs. There's your respiratory drive, and then there's peak effects. What's happening here in this case is he was being treated for insomnia and not treated for addiction. The addiction was the big elephant in the room that nobody really was looking at. But a peak effect means how long does it take for it to work? And in this case, if he's being treated for insomnia, how long does it take to get to sleep? But the additive effect of all these medications to decrease the respiratory drive is hours upon hours upon hours after the peak effect.
So in your opinion, with this whole cocktail, does this spell out that Dr. Conrad Murray is probably going down?
No, this is only speculation. What we really look at is standard of care in this case. So is the standard of care to take propofol and to take Versed and give it to somebody in their house as opposed to giving it to somebody in a hospital or in a supervised medical facility? In my opinion, that's a scary part of this case for Dr. Conrad Murray. And I just want to say, I feel bad for the guy in the sense that this was a really difficult case. This was a big addiction case.
Yeah.
In addition to the insomnia, and he decided to take it upon himself and try to figure this all out when there should have been a team of addiction medicine doctors, anesthesiologists, psychiatrists, therapists, and all these other people that needed to be a part of this case.
Right. So what I'm hearing is there's no question in your mind that Michael Jackson was an addict, and Dr. Conrad Murray had said he was supposedly, as of June 22nd, trying to wean him off propofol, and yet this timeline of events that we now see what he did at around 10:30 in the morning, when all the other drugs didn't work, he gave him 25 of propofol. What does that say to you?
Yeah, I mean, it really seems like if the reports are true that he was saying, I don't think propofol is a good idea because there's not known to be major abuse liability, but the reason is because most people don't take propofol in their house.
Right.
So we don't really know exactly what the abuse liability is. But for whatever reason, he needed it more and more and more, called it milk, called the lidocaine attached to it as anti-burn. I mean, he had nicknames for all these medications. The propofol itself was something he didn't want to give him. So if he went from Valium to Ativan to Versed, which is also a dangerous drug given outside of the hospital, and then propofol, it seems very desperate on the part of the patient and on the part of the doctor.
Right. Now, Dr. Reef, we've certainly talked about propofol a lot. Can you talk about what you can speculate Michael Jackson's interest was in this drug that's not standardly used outside of a hospital setting?
Yeah, propofol is an anesthetic, right? It's used to induce anesthetic properties, sedation in somebody before a surgical procedure, and you need to watch out for intubation and respiratory drive decreasing and all of that. But propofol is not going to give you a great night's sleep.
It's not.
It's not like this.
He thought it was,
yeah,
I guess.
It brings you in and it brings you out, but it doesn't give you a great night's sleep. What it does do is it relaxes you. It chills you out. If you've had this crazy day and you just want to go down for a little while and then come back up, you could do that with this drug. But it's only to be used in specifically medically supervised procedures. So perhaps this was his way to just escape and chill from all the craziness going on in his world. And instead of using a psychiatric team, instead of using therapists, instead of using medical professionals, he was using propofol. Perhaps that's what was going on.
Dr. Reef Karim, addiction specialist, thank you so much for joining us and shedding some light on this developing story.
Thank you for having me.
Absolutely. Hollywood 411, we'll be right back.
Reef.